How's it going, beautiful people? Today, on my series of videos where I focus on pre-med and med school, we're going to be talking about why I decided to apply to both allopathic MD and osteopathic programs, also known as DO school. Believe it or not, I get asked this question quite a bit in my daily life because I have friends who are trying to apply to medical school. I have underclassmen who are always like, why would you apply to both? And generally, I can actually answer that question by just saying this.
¿Por qué no los dos?
You see, when it came to me deciding on where to apply, it didn't really matter to me what would be the last initials of my name once I became a doctor. Whether or not you have an MD at the end of your name or a DO at the end of your name, you are gonna get the same licensing rights and practice rights as all doctors in the United States. And of course, a lot of people are like, well, if you are a DO, you won't be able to practice internationally as much as allopathic doctors. But to be fair, how often am I going to go to another country to practice medicine? I'm an American citizen. I love America. Planning on staying here for the rest of my life. Don't have any plans on moving. So I'm completely fine with the idea of applying to both. In addition, there are a couple of things that made me realize that I don't really see a difference between my form of education between going to an allopathic school or an osteopathic school. And there are a couple of reasons why I decided to apply to both. One being my stats. My stats is kind of on the average scale, so I wanted to maximize my potential to actually get accepted somewhere. Two, the osteopathic cycle actually starts sooner, and you actually get acceptance notices sooner if you interview much more early on in the cycle. You don't have to wait for that October 15th deadline that they set. It's not a deadline, but it's like an early line, I guess, that allopathic schools can actually start telling their students. Osteopathic schools don't have that. So I was like, well, if I apply to both, I can get a decision much more quickly from an osteopathic school, which will relieve a ton of stress. Like, you guys have no idea how stressful the whole cycle is until you actually enter the cycle, but it's months and months and months of waiting and waiting for something good to happen. And I realized that if I applied to both, I might get a decision sooner rather than later. And it turned out to be true. My first osteopathic acceptance letter came around the end of September. My first allopathic acceptance letter came at the end of November. There's a 2-month difference between the two. Also, a lot of people choose not to apply to osteopathic programs because they think education will be different, but to be honest, there's not much of a difference. You get the same basic science requirements met whether or not you go to an allopathic or osteopathic program. And although a long time ago the two different schools of thought were different, nowadays they're pretty much the same. Like, osteopathic medicine branched out of allopathic medicine because the founder, A.T. Still, believed that there wasn't an emphasis on looking at the patient as a whole, and also there was no emphasis on preventative care. However, over time, that distinction has become almost incomplete because of the fact that allopathic medicine now also emphasizes looking at the patient as a whole, doing a holistic form of medicine, and also emphasizing preventative care. And yes, absolutely, you can make the claim that most osteopathic schools are not associated with a hospital or university system, so you're going to be traveling around the country to meet your rotation requirements. However, to me, that doesn't mean much. I'm willing to do whatever it takes to become a doctor. I want to be a doctor. I can't see myself doing anything else that I'd be as happy with. So if it means, yeah, I'll have to travel every few weeks to a different state to meet my rotation requirements, I'm still willing to go through with it, and that's why I applied to both. And yes, osteopathic medicine also has OMS involved in their curriculum, which is an additional couple of months doing this kind of hands-on approach kind of medicine that is not in allopathic medicine at all. It's incredibly unique that you don't get to see often with a regular MD doctor you go visit. But I'm someone who wants to go into primary care, so whether or not I go to an allopathic or osteopathic program, that OMS training will eventually help me in the long run, because OMS is often used to treat pains without the use of medications. So that could just be in addition to the practice I do. I don't see it as a nuisance at all. It's just increasing the breadth of knowledge that I have to help treat a patient. So I don't really see a difference between the two. That's why, in the end, I was like, why not both? And lastly, I think this is the most disheartening reason why people choose not to apply to osteopathic school, is because that there's been a stigma around osteopathic medicine for a number of years, because allopathic medicine has been around for so long. A lot of people see DO doctors as not as up to the same level as allopathic medicine. However, that's not necessarily true, and I think it's just kind of ignorant for someone to make that kind of distinction. Like, I have a classmate who's also applying to medical school, and she decided to strictly apply to allopathic programs. And then I was like, hey, have you thought about DO school to, like, expand your breadth of schools you are applying to? And she just looked at me and she was like, no, I'm not gonna do that. And I was like, why not? And she was like, well, my mom's told me some things about DO doctors that they're not really legitimate. And I just ended up looking at her like, because there is no difference. That's just a stigma that's been around for so long. And yes, will the stigma affect you? Most people recognize allopathic doctors and osteopathic doctors as equals, and if there is bias against you by someone out there, just ignore them, prove them wrong. That's all you need to do. Show them that you are capable of it. And yes, if you have a completely legitimate reason why you don't want to apply to osteopathic programs, like I talked about the disadvantages beforehand, that is completely fine. That's pretty much it, guys. That's why I decided to apply to both. Whether or not I become an osteopathic doctor or an allopathic doctor, in the end, I'm going to be a doctor. You're going to come to my office, and I'm going to give you that annual physical. So, yeah, there's not much difference, and that's why I applied. Thank you guys for watching. Be sure to like, subscribe, share this video, and I'll see you on the next one.